See, that's 2 calories.
3, 4, 5, 6. That's no. It's 6. It's 6 for 4. 6 plus 5.
We got
It's 11.
We got
We're out of money. We're just policy. We play with words, not numbers.
Close enough for
One of us left, we'd be in trouble.
Really? Oh, I haven't busted that one out. Oh, wow. All right.
6 of them.
So, all right, welcome back after Florida. That went a little bit longer than expected. Apologies for those who had to wait for us. Picking up a little bit more work on H233 and act relating to requirements for state funded grants. And we will, first on my list, I got Kara Mayo from Agency of Transportation. How you doing?
My name is Kara Mayo, and I'm one of the audit specialists for the audit team for AOT. So I'm here just to talk about one of my jobs with the audit team is to review and negotiate with the 11 RPCs, which are the nonprofits. So this task for us is it's very time consuming. It's very cumbersome. It's a task not only for us, it's a cumbersome task for them. So each RPC needs to follow the MOU that's in place and submit their audited financials with the financial report, as well as their cost allocation plan with their proposed overhead rate. And once we receive those, we then review them, audit them, and negotiate with them. The RPCs follow the same guidelines and the 2 CFR 200, which is specific to nonprofits overhead rates. And each nonprofit has 3 ways to obtain an approved overhead rate. They can use the de minimis, which is 15%. They can use a cost allocation plan, which is what most of the nonprofit RPCs do. Or they can do the indirect direct cost rate calculation. And just for the record, I think AOT wants to make sure we say that we oppose the bill due to the time and resources that it would take for our small staff that we have. It would be an added burden for us to negotiate additional nonprofits on top of the 11 RPCs that we currently complete at this time.
Yeah.
I, just for clarification, I think that the process that you use is appreciated, and RPCs had said that they think that it works well. And so I think
they have a great
part of what they were wanting to know is if that process that you already have in place not to do another one could be applied another, not for you to do all the whole state's process, but that could be applied elsewhere.
So the process is already in policy. It's already in procedure. The 3 ways to obtain an approved overhead rate are already in policy. So yeah, I mean, anybody can follow those and do that.
Anything else? Thank you very much for.
Thank you.
And Lauren.
Good afternoon. Good afternoon. Thank you. I'm good. How are you?
Good, thank you.
Good afternoon. Thank you so much for having me, Chair Barong, Vice Chair Hango, and the members of the committee. I'm really grateful to have the opportunity to testify today on this bill. My name is Lauren Miltenberger. I'm the interim MPA Director and Nonprofit Coordinator in the Department of Public Administration at Villanova University. I'm here to express my strong support for House Bill 233. It takes an important step towards improving the relationship between the state of Vermont and its nonprofit partners by adding some needed elements to the grants and contracts process. This legislation is timely, necessary, and it's deeply aligned with the realities of the field. There's significant research and scholarly support for the issues that exist between nonprofits and government in the grants and contract system. This is not just a Vermont issue, it's a national issue. About 10 years ago or so, the Urban Institute completed a national study on this topic, that found, for instance, nonprofits reporting problems with government funding. About 70% of the nonprofits in the study reported complexity of the time required by the application process. About 70% of the nonprofits in the study reported complexity of time required for reporting. About half of the nonprofits in the study reported that the payments did not cover the full cost of contracted services. And again, about 45% of the nonprofits in the study reported that late payments were common. Also, the National Council of Nonprofits tracks noteworthy bills on this issue. And also, I'm currently working with two MPA students in our department on a 50-state review of this issue. So we have also been tracking the work across the country on this issue. And what we can tell, 44
You're starting to break up a
bills
little bit,
proposed
maybe.
across 20 state legislatures.
You're starting to break up a little bit. Maybe try to shut your camera off and maybe, we've had some Zoom issues the last day or two. Give that a shot.
Okay, sorry about that. Is this better?
Is
this better?
There we go. That
How's
sounds
this?
like
Is
it's
that
coming
better?
together. There we go. That's much cleaner.
Okay. Nice. Okay, great. Thanks for letting me know. Sometimes it goes on and then you're like, wait, can you go back? I appreciate that.
Uh-oh, it's doing it again.
Okay, so we're okay.
Worse.
So the National Council of Nonprofits track. Oh no.
Oh, now
let's
you're clear.
see.
Try it again. Oh, no, we might be good now. Give it a shot.
Okay. Okay. Let me move around. Is this better?
Yep, yeah, it sounds all right. Give it a shot.
Okay. So the National Council, 24 alone, there was 44 bills proposed in 20 state legislatures across the country. So clearly you're not alone with this, and I do commend you for taking on this this important issue. So there is a lot of data, research, analysis, and scholarly literature, list of articles, reports, and scholarly research on this. But for me, this issue is personal. I've been involved with this issue in some shape or form for the past 25 years. First as a nonprofit, and then as a researcher, and now as a researcher investigating and identifying the core issues impacting this relationship. So I know a few things about this, and the first thing that I would like to say that I know is, and the first thing to discuss is that I know that and processes that each of them, each sector must deal with. Point blank, what I just heard, right? So in the bill, it's the nonprofits, or the issue of indirect culture across the country. How do we achieve that? And then you're hearing from on the agency side, the state side, that those things already exist. So that's just one example of how the cities and the systems and processes that each sector must deal with, they're not known to each side, and that the current system has evolved over decades with agencies doing what they're required to do. So this is not about placing blame on, and my perspective is to reduce the complexity associated with the system as a whole, make it more efficient, and help both nonprofits and government agency contracting managers is to fulfill the obligations of the contract, which is about providing programs and services, and less time on the filing of complex reports, invoices, and applications. Okay, so couple more minutes here, if I may. So what I have also come to know is that the issues associated with this, with nonprofit government contracting and grants, the relationship, it really spans across three major areas. The big three P's, the big threes are what I've come to know: payments, issues around payments, number one. Number two, issues around the process. And then the third one is problem solving, how to actually solve this problem. So what I want to do now is just take another couple minutes and speak to each of these three major areas: payments, process, problem solving, define it a bit, discuss solutions that are happening in the field right now, real current examples, and then connect it back to the provisions that are in this bill. So, first of all, payments. So, the issues surrounding payments are, does it cover the full cost of services, the indirect rates, as we already discussed? Now, OMB has set the, guidelines that changed last year, requiring the minimum to go up to 15%. And I know that in this bill was the language of creating a process and formula for nonprofits to request an indirect rate above the current standard of 15%. And that is very common across what we're seeing across the country. Another big part of the issue of payments is too often nonprofits wait months for reimbursements for work already completed. And I know that, in Vermont, you have the 30 days. And so it's just a matter of, I think, again, understanding on both sides when does the nonprofit start it? When do they start getting paid? And really fully understanding when does the payment start? So here's a couple examples in practice right now. So Maryland recently passed a prompt payment law. California recently passed an advanced payment law, which is much more in line. I believe the California legislature approved up to 25% of prompt payment in advance payment. And that's something I'm happy to get you some more information on. And the advanced payment structure is following more of a trust-based philanthropy model. But again, understanding the guidelines and the requirements and regulations associated with the funding. So, Maryland is you'll see is a leader on this issue. Maryland also passed an indirect cost rate, which I can get you information on. The state of Illinois prohibits indirect costs lower than 20% of direct costs of the federally negotiated rate, or whichever is higher, unless the recipient prefers lower, which I'm sure, doesn't happen. So payments, it's about full cost of services. When does the cost process start, the reimbursement process start? The invoicing process, the complexity of that is involved with this. Indirect rates is also a huge piece of the payment process, of course. So now getting to, what is included in this bill. Yes, I'm reading language directly from the bill. Assess, right? Assess the extent to which grant execution and payments are delayed by more than 30 days. So it's doing an assessment, right? It's like you're gathering data with this process. And I was here, I heard the testimony earlier of our colleague, and I think, both, researchers understand that there are complexities and on both sides, right? So the solution in this bill is about assessing, like do a study, that's what I think the working group is all about. And then also we talked about the creating of the indirect rate. Sounds like there already is a process for that. Well, then it just needs to be communicated maybe more clearly or offered, maybe there's some ways to exchange that information so it's done in a way that everybody understands the specifics. Also, I saw in the bill, in terms of payments, our first big area, the working group, it was suggested that this working group review the state's current grant funding levels and identify cost of living or other inflationary adjustment, which of course makes a whole lot of sense. And then the last piece in terms of payments was under the working group section, assess the specific circumstances under which funding should be in advance, right? So being like California doing some type of advance payment process. So that's the first big category, all about payments. Second big category of issues surrounding this nonprofit government contracts and grants relationship is process, improving the process, streamlining the system. And again, this is something that has a lot of support for in the literature, in current task forces that are happening across the country, and past reports, just streamlining the current system. And again, this is not due to any one organization or agency's fault. It's just that, and I'll speak from my own personal experiences, 25 years ago, certainly things have changed, but we used to receive up to, I worked at a YWCA affiliate. We used to get, anywhere from 10 to 12 contracts from different agencies. Each agency has a different process, and unbeknownst to them. So it's all about streamlining the current process, and it includes before the contract, the RFP process, the application process, and then during the contract, the reporting, the invoice, the reimbursement process is extremely cumbersome. And if you even have 5 contracts with 5 different agencies, you're doing 5 different things. Sometimes I understand the research is clear. Because of the rules and regulations in the guidance, you can't do that. But when you can streamline it, it's beneficial to both. Well, it's beneficial to everyone. It's beneficial to the nonprofits. It's beneficial to the government agencies. It's beneficial to the taxpayers, right? So that's the second big issue, is process improvements. So what's happening in practice? So there's a big thing that's happening across the country right now is creation of portals, databases to streamline the process. So I'm going to give you a couple examples. California has a grants portal. They passed this via law recently where, there's a portal. They're trying to streamline, make it simplify the process for applying for grants in California. In New York, this dates back to 2011. The governor at the time started a grants reform initiative back in 2011. Fast forward to just a couple years ago, the state grant database, which started back then, transitioned from the grant gateway portal to a statewide financial system, but again, a portal of some sort in the state of New York. A third state, North Carolina, passed a bill that directs OMB to adopt rules for the uniform administration of grants across the state, but the bill didn't specifically state to create a database, but the database then was an initiative on the part of the state chief information officer. The last state that I'll give you in terms of process specifics is, again, Maryland, leader in the field on this issue. They established very recently the Maryland Efficient Grant Application Council to monitor, report, and make recommendations on the state grants, life cycles, applications, recipients, and then obviously understanding both sides, right? Requires an understanding of the regulations or, the uniform grant requirements that are required by the government agencies, a clear communication, transparency, and then how can we, create a system that is more efficient, streamlined, and a better process. And again, last piece of the process, these elements are in your current bill that you're discussing, the working group, right? Create this working group to consider needed reforms to the state's grant and contracting system to make it more viable, predictable, and efficient. And this would also attempt to simplify the grant application and reporting process. So those are the first 2 big issue areas. I gave you some examples from the field and how it connects to the current bill. The last thing is this issue of problem solving. How do we, really tackle this issue? And this is something that, I feel particularly passionate about in terms, and I commend you, again, the language in this bill of having a working group, or other states across the country have called them task forces, same things. How do we effectively solve this problem? Well, you can go the task force route or working group route, which a lot of states have done. Another thing that fewer states have tried is creating a nonprofit liaison or even a cabinet position. Connecticut tried that for a little while, but the task force is much more popular. So right now, in Kentucky, Illinois, and Oregon, they recently passed laws to also start working groups or task forces to look at this issue. And I fully support the initiative to create a working group that you are evaluating to improve the grant process. I personally think that it is a great place to start. You need to get people across both there's a divide, and how do you fix this issue? It's exactly what you have in this bill. It's about bringing people to the table to talk about the issues, understand the misunderstandings that exist, and provide a clear path and recommendations to evaluate the current process and figure out ways. Sometimes you can't, but where can you streamline? Where can you fix this? So this, and I personally did a study published back in 2017 with Margaret Sloan from James Madison, where we looked at that time, this was back, almost 10 years ago, Connecticut, Hawaii, Illinois, Maryland, Texas, New Jersey, New York, Maine, North Carolina. They all had task forces or working groups at the time. And again, I could send you the information if you'd like to read it. We did a review of what makes a good, what the process could look like for a task force, how to be collaborative. And another group, the National Council of Nonprofits also has a specific report called Partnering for Impact that reviews how task forces on this issue or working groups produce results for taxpayers and make the system more efficient. The conclusions I had with my colleague, Dr. Sloan, and what the National Council of Nonprofits, are task forces are great places to start. And working groups are wonderful places to start because they reduce the confusion. They get people to talk. Back in when I started researching this topic, I was at the University of Delaware. I was on it was called the Forward Together Project, and we were tasked with researching this exact issue. We created task forces. I led one of the task forces back at the time, and I was a part of the process to have the equal representation of nonprofit leaders, government agency leaders, sat around the table, took these different issues and figured out what was the best way to move forward. So in conclusion, this bill offers a thoughtful, forward-looking response that during the current climate of uncertainty in federal funding is especially needed. It balances the state's need for accountability with the nonprofit sector's need for predictability and partnership, and it makes the whole system more efficient and better for taxpayers. I urge the committee to support House Bill 233 and move it forward. Strengthening the state's relationship with its nonprofit partners will not only improve service delivery, but it also promotes a healthier, more resilient civic infrastructure for everyone in Vermont. Thank you so much.
Thank you. Any questions for Lauren? Rep. Nugent.
Thanks for sharing the scope of your work. I was wondering if you have a sense of, because we saw a report that showed like how many states are or have done or are working on this issue. And I think maybe you said that, but if you have
Yes.
that, yeah.
Yeah, great question. I'm going to try to put the video camera back on. Just
Yeah, you're doing all right now. So
Okay,
ride the wave.
Thank you. Let me know though if it breaks up. I'm sorry about the Zoom issue. So right now it seems like there's 3 or 4 current states that recently passed, but again, this issue the creation of task forces or working groups is something that is relatively common. So I would say, I mean, I would have to go back and read through all my notes, but there's at least 3 or 4 states. So it was Kentucky, Illinois, and Oregon recently passed laws to start this, but there have been, and so when we did our study, there was 10 states. I'm sure in between we could find some more. I mean, my guess would be anywhere from 20 states, have had this experience and or have created the opportunity to bring people together and have a working group type of situation. And, what we found was, and what the National Council found in terms of like best practice in the working group is be clear on goals, be clear on directive, set a timeline, bring people to the table, have the issues identified, listen to each other and support. So I'd be happy to share more information specifically on the best practice side of what, National Council did a great job on this. I could share with you. Our paper looked at how to make it a more collaborative process, how to really look at it in terms of like a partnership model. And I get the vendor-based, market-based relationship of contracting and granting. But it's also an important perspective to think about. These are partners, and we're working together to understand and reduce barriers in terms of communication and transparency. I hope that answered your question.
Thank you.
Yes, thank you.
Anything else? No, thank you so much for your time. And we're going to keep working on this one into the coming week or so. So if you want to share any of the information that you referenced, please feel free to email the committee. And we
Yes.
can
Happy-
catalog it. Yep, we can catalog it in our testimony. And we appreciate your time.
Oh, I appreciate the opportunity. Thank you so much.
All right, guys, final order of business today. Let's see. Weird.
Must be very.
Yeah.
Starter.
No, I'm not, I'm Chris Howard from Rutland Four, I'm here because the charter was, we were discussing the Rutland charter.
Yeah, we're doing that right now.
I wasn't.
I don't think he's the presenter.
I'm not-
Yeah,
Mary Howard